So while cancer research has made significant leaps and bounds in identifying new medicines to improve outcome, equally dramatic have been the advances in our understanding of the role and relevance of exercise in improving outcome too. We know that fitness plays key roles in our resilience to ill health and can also aid the physical and mental recovery from other forms of cancer treatment. So it's great to have Mairéad, I suppose, to learn a little bit more about that. And I'll give a little bit of background on Mairéad and where she has come from. So Dr Mairéad Cantwell is a lecturer in the Department of Sport and Health Science in Athlone Institute of Technology. Mairéad graduated from Dublin City University with a first-class honours degree in Sports Science and Health and completed a master's at Liverpool John Moores University in Clinical Exercise Physiology, where she graduated with distinction. Mairéad worked as a clinical exercise physiologist in Ireland, the UK and Australia from 2011 to 2018, where she gained extensive experience in cardiac, pulmonary and oncology rehabilitation, both in a hospital and in community-based settings. Mairéad completed her doctorate at Dublin City University in 2019 in the area of oncology rehabilitation, and her PhD was funded by the Irish Cancer Society, so that was made possible with the generous donations that we get from the public. And Mairéad was the recipient of the Irish Cancer Society's first PhD Researcher of the Year award. Mairéad began her current role in Athlone Institute of Technology in 2018, and she is part of the Institute's SHE, Sports, Health and Exercise Research Group, which aims to bridge the gender data gap in sport, health and exercise science research. Her research focuses on the role of physical activity and nutrition in the treatment and management of chronic disease. So a few housekeeping notes. So Mairéad's going to talk to us for about 25-30 minutes and she'll be delighted to answer as many of your questions as we have time for. We've muted everybody and we'd ask everybody to stay muted and have their screens off. It just reduces distraction. But we'd be really grateful if you put your questions in as we go along into the chat box at the very bottom of your screen there. So if you think of a question as you're going along, feel free to put it in there. And as I said, we'll try and get to those or as many of them as we can at the end. Mairéad, if you want to start sticking up your presentation there as well. Feel free, if those of you who are on social media, if you want to take a screen grab or tweet or anything like that, very happy for you to do that. And finally, just to let everybody know, we are recording this talk and we will make it available afterwards. So if you want to get it, and also for those quite extensive numbers of people that unfortunately couldn't, we didn't have room for in this Zoom session today, they'll also be able to access it. So Mairéad, without further ado, I'll pass over to you and thanks again.
Great, thanks Rob. So good morning everyone. It's really fantastic to be here with you today. Thanks so much to the Irish Cancer Society for the opportunity to deliver the webinar, and thanks so much to everyone at home for coming along. Rob has introduced me there, but I suppose just to give a little bit more context maybe to who I am and what it is that I do. So I'm a clinical exercise physiologist, and that means I promote and prescribe exercise in the prevention, treatment and management of different chronic diseases. And I'm currently working as an assistant lecturer in the Department of Sport and Health Sciences in Athlone, and through my position in AIT, I also have the opportunity to do research through our SHE research group, which focuses on sport, health and exercise research. And I was very fortunate that from 2015 to 2019, I was funded by the Irish Cancer Society to conduct a research project that investigated the role of physical activity following cancer treatment. And so today, I just wanted to talk to you about that research. We'll first set the scene a little bit by talking about what physical activity is and why it's important, particularly in the context of cancer. And then we'll move on to look at the research that we did as part of this project, what we found, and most importantly, how it might help to positively impact cancer care in the Irish context. So just to set the scene, first of all, what is physical activity and what do we mean by that term? Well, really, physical activity is an umbrella term that incorporates all types of movement of our body. And it comes under different categories. So we can consider active living. So this is incidental movement that we might accumulate throughout the course of the day, whether that's doing jobs around the home or movement that we might do as part of our occupation. Then we have structured exercise. So this is purposeful and structured movement that is done to improve our fitness and our strength. And then we also have sport, which obviously requires that level of physical exertion, but also has a skill component to it. And we engage in physical activity in different intensities, and they're broadly classified as light, moderate, and vigorous intensity physical activity. So light intensity activity would really incorporate that active living movement that I spoke about in the previous slide. Moderate intensity activity is where we start to see an increase in our heart rate, our breathing rate, we start to sweat, our face becomes a little bit red, we may feel a little bit short of breath. And then the magnitude of that response is even greater when we engage in vigorous intensity activities like running. And intensity is important because we know that exercising at greater intensities gives us a better return on investment. And what I mean by that is the impact on our health is greater when we engage in more moderate and vigorous intensity activity. But we also know that what we call a dose response exists for the relationship between physical activity and health. And that relationship is summarized on the slide here. So if we look at person A is engaging in a low level of physical activity participation. And if we were to achieve even a modest improvement in their levels of physical activity, we can see on this axis here the magnitude, the degree of benefit that they would achieve in terms of health benefits is really significant, even though the increase in their activity levels is just modest. And if we look at person B and person C, they engage in higher levels of physical activity participating again. And while they also achieve more health benefits, the magnitude or the degree of that response isn't as marked as for person A. And so really what I'm trying to suggest from this relationship is that the people who have the most to gain in terms of becoming more physically active are the people who go from doing nothing to doing something. And when we talk about the health benefits that are associated with physical activity, what do we mean specifically? Well, really, as you'll see indicated by the pictures here, physical activity can have a positive impact on all organ systems in our body. So we know that it can improve our physical and our mental health, it can improve our quality of life, it can help to prevent the development of many chronic diseases, including cardiovascular disease, diabetes, and cancer. And it can assist in the management of those conditions should they occur. And specifically in the context of cancer, we know that exercise before, during, and after cancer treatment can improve physical functioning and quality of life. It can assist in treatment-related side effects, such as fatigue and helping to manage weight. It can optimize our mental health by reducing symptoms of anxiety and depression. It can optimize our heart health, strengthen our muscle bones and joints, and increase confidence. And perhaps most important of all, the research now suggests that individuals who engage in regular physical activity during and after treatment have a lower risk of cancer recurrence and improved survival compared to individuals who remain to be physically inactive. And so the take-home message there really is that fitter people live longer. And such is the wealth of scientific evidence to support the benefits of physical activity. It's now recommended that physical activity should be included as a component of patients' cancer care, and that has been advocated for. And so in this way, we see that exercise is medicine. So while we might take a tablet to lower our blood pressure or to lower our cholesterol, exercise is what we call a polypill. Not only will it have a beneficial impact on one aspect of our health, but on many. And so if exercise is the medicine, what is the how much physical activity we need to engage in order to achieve health benefits? And so it's recommended in the context of cancer that individuals should engage in at least 150 minutes of moderate intensity aerobic activity. So that's whole body exercise like walking, cycling, swimming, and that's supported with 2 resistance exercises each week. Includes muscle strengthening activities. And it's important to say that these guidelines aren't only recommended in the context of cancer, but for general population health as well. And ideally, to maximize those health benefits, we should aim to be physically active every day where possible. And so when we began to design this research project for my PhD, we thought, okay, great. We know that physical activity is beneficial before, during, and after cancer treatment. And we know how much physical activity we should be recommending to people to achieve those health benefits. But it also became clear that there were lots of questions that we didn't know the answers to. So if physical activity is being encouraged to be included in patients' cancer care, is that something that healthcare professionals are talking to their patients about in the Irish context? And while we know that it's recommended that we should achieve the 150 minutes of moderate intensity aerobic activity in the 2 resistance sessions a week, is that something that's achievable for individuals who are going through cancer treatment and afterwards? And what are the challenges that they can face in being physically active? And also to look at the role of community-based programs, and could these programs support increased levels of physical activity participation and to optimize health and well-being outcomes following cancer treatment. And so to address this, we developed the project for the PhD, and it really aimed to explore physical activity across the cancer journey from the perspective of oncology healthcare professionals and patients. And then we wanted to use that information then to develop, implement, and evaluate a physical activity program for survivors of cancer that will be delivered within a community-based setting. And the project overall encompassed 3 studies. And so for the next few minutes, I'd like to just take some time to walk through each of these studies to tell you what we did, what we found, and again, what the research impact might be. So looking at study number 1, we conducted an online survey with healthcare professionals who work in oncology. And we asked them what their knowledge and attitudes were towards physical activity in the context of cancer, and also what are their recommendations. If they recommend physical activity to their patients, specifically, what do they advise? And then we also wanted to learn if a healthcare professional was to refer a patient to community-based program, what are the barriers that or challenges that they experience in doing so? What would motivate them to refer a patient? And how could that referral process be optimized from their perspective? And we had 43 participants take part in round 1 and 48 people take part in round 2. And we obtained a huge amount of information from this study. So I just wanted to highlight a couple of the particularly important findings for the purposes of today's session. So the first was that when physical activity was recommended to patients, the most common method for that advice to be given was verbal advice. But we also saw that physical activity was not discussed with every patient. And at all stages of the cancer journey, with the exception of advanced progressive disease, physical activity was more frequently recommended to patients who've had a breast cancer diagnosis compared to patients who had a colorectal or prostate cancer diagnosis. And the rates of physical activity promotion ranged from between 29 and 53%. When we asked healthcare professionals about the specific of their recommendation, we also saw that for the majority of those recommendations, they did not align with the recommended physical activity guidelines that I spoke to you about earlier. And when we asked how could the referral process to community-based exercise programs be optimized, healthcare professionals told us, make that process standardized, make it electronic where you can. Improve access and awareness to information about the benefits of physical activity and existing exercise programs, and to provide education to both healthcare professionals and patients about the benefits and the importance of physical activity, and to provide feedback to the healthcare team on how patients are progressing through these programs. And so the results of this study showed that oncology healthcare professionals may need more support in promoting physical activity to their patients. And by referring patients to community-based exercise programs, this could help to give patients access to physical activity specialists who can provide the necessary detailed guidance and recommendations for exercise. And we know that healthcare professionals play such a central role in motivating individuals to adopt positive lifestyle changes. And this research identified practical recommendations to minimize the barrier to referral. And that could therefore facilitate greater access to physical activity supports for individuals living with and beyond cancer in order to optimize their health and well-being. In our second study then, we wanted to talk to individuals living with and beyond cancer. So we conducted a number of focus groups that focused on learning, well, what are your experiences of physical activity throughout the cancer journey? And if you were to take part in a physical activity program, what would you like to see in there to support you to make physical activity part of everyday life? And so we did 7 focus groups with 41 people. Over 50% of our participants were female. Just over half were aged between 51 and 60 years. And you can see the breakdown of the different cancer diagnoses that our participants had here. So again, we gained an absolute wealth of information, but I'm just going to highlight 3 particularly important findings for the purposes of today. So the first is that participants reported a number of benefits of physical activity, including improvements related to their physical, their psychological, and their social well-being. And collectively, these combined benefits resulted in many individuals viewing exercise as a vehicle for recovery because it facilitated self-power, whereby participants took ownership and control of their physical activity to increase their well-being.
Great.
Yes.
So that's actually in your lease.
Yeah.
Now, some of the apartments up there could have been.
Sorry, could everybody mute their phones, please? Right, just need to get you to unmute. Yeah, you're muted there. Sorry about that.
Can you hear me there?
Yeah, we can hear you fine.
Perfect. Great. So for many individuals, this was associated with increases in self-confidence and belief in their physical capabilities. So physical activity assisted in the transition from cancer patient to cancer survivor, and it provided individuals with a medium through which they could learn what physical capabilities were. And just to illustrate, this opinion or this point of view from participants, this quote really summarizes it, I think. So when you get into the cycle of exercise, you think, well, you've been fed a bit of information. Information is power. I can do this for myself. You know, you're reclaiming a bit of yourself, and it really motivates you. However, a number of challenges to physical activity participation were also reported by our focus group participants, and they were categorized as environmental, patient, and treatment-related barriers. And many individuals reported experiencing a period of isolation after they finished their treatment. And as a result of reduced contact time with treatment centres and a lack of direction regarding how to recover after cancer, many participants reported a decrease in their physical and their psychosocial well-being. And they viewed this as a gap in the cancer care pathway. And many participants reported the lack of cancer-specific physical activity programs that were available at this time, and really voiced the need for a holistic approach to rehabilitation. And this participant said, just to illustrate that point, then suddenly you're discharged and you're out on your own. I was in absolute limbo. You're just in a very lonely place to cope with all of this. And when we asked what strategies participants would like to see included within a community-based program to support them to make physical activity part of everyday life, 6 key things really emerged. So our participants told us, if you could assess my fitness, let me know how I'm doing and how it's improved as I engage in exercise. If you talk to me in a one-to-one level about how I can be physically active, what the benefits are for me, and address my concerns about becoming active after cancer. If you could give me a means to measure or quantify my physical activity so I can see how much I'm doing. If you can work with me to set goals and an action plan about how I can make physical activity part of my everyday life. And they also told us that combining supervised exercise with home-based exercise was really important, and that exercising as part of a group of individuals who had a shared experience around cancer was also really important. And so what did we learn from this study? Well, the results showed that many individuals viewed exercise as a vehicle for recovery and a means through which they could optimize their physical and their psychosocial well-being. But the cancer experience can also present a number of unique challenges that negatively impact physical activity participation. And this study was the first study to qualitatively document the physical activity experiences of a large, diverse group of people living with and beyond cancer, and their recommendations for ways to make physical activity part of everyday life. And this information is absolutely invaluable in informing future research and assisting in the development of physical activity programs for individuals living with and beyond cancer. And so in our final study, we wanted to take what we'd learned from speaking to oncology healthcare professionals and individuals living with and beyond cancer to see how could we design a physical activity program to support the optimization of health and well-being. So this was quite an extensive process. It took us 18 months from start to finish to design the program. And it started with those recommendations that participants shared with us in the focus groups. We also looked at the scientific literature to see what have other studies done and what has been shown to be effective. And we also applied what's called behavior change theory to try and understand from an exercise psychology perspective, what are the changes and processes that people need to go through in order to make physical activity part of everyday life. So when we got a prototype, if you like, of the program developed, we asked a stakeholder expert panel, which included individuals living with and beyond cancer, as well as professionals working in oncology across a whole range of disciplines. And this is what we're thinking of doing, and what do you think? What are your recommendations around how we could optimize that and make it better? And so the end product was what became known as MedX Impact, and Impact stood for Improved Physical Activity After Cancer Treatment. So the program itself included 4 things primarily. First was that participants were invited to attend 2 60-minute exercise classes that were supervised, and they were twice weekly for a 12-week period. They were also given a home-based physical activity program, and I'll tell you a little bit more about that in a second. And they were also invited to attend 4 physical activity information sessions and a one-to-one exercise consultation. So the home-based program, what did that include? So we designed a physical activity manual, which included exercise classes that participants could do at home. We also gave their participants a pedometer, which was a means through which they could count the number of steps that they did on a daily basis. And we also gave them a logbook where they could record the amount of physical activity that they did on a day-to-day. In terms of the physical activity information sessions, there were 4 of these that were hosted over the course of the 12-week period, and they focused on a number of topics ranging from the benefits and importance of physical activity in the context of cancer to strategies to support long-term participation in physical activity. And we sat down with each participant on a one-to-one basis to say, okay, when the 12-week program finishes, how can you keep physical activity going for you? What are your preferences? What are your interests? We tried to set an action plan around that. So just to pause here, I suppose, and to highlight really that this approach was unique because we were delivering the program in a real world setting. Oftentimes these programs can be delivered in a controlled research environment, and we can test different things in that setting, and then we need to learn, well, how can we transfer that from a research environment to a real world program? And so our approach was unique in that we were jumping straight to the delivery in a real world setting. And because of this approach, this provided actionable information that could be implemented with immediate effect, and therefore minimize the delay in optimizing patient outcomes. And again, this type of information is really needed in order to inform the planning and provision of community-based exercise programs for individuals living with and beyond cancer. So that's what the program looked like. So how did we test its effectiveness? Individuals who were referred to the program were invited to take part in the study, and they gave their consent to do so. They were invited to complete a baseline assessment, and I'll talk through the details of what that consisted of in a minute. And then we had two groups. So we had one group that received twice weekly supervised exercise, and then we had the MedX Impact group who received the home exercise program and the other things I highlighted in the last slide. And then we asked participants to come back at the end of the 12-week program and 3 months after they'd finished to see the impact that the program had had at that stage. So in terms of what we measured, we asked participants to attend for an assessment over 2 days. On day one, we looked at aspects of body composition, flexibility, strength, quality of life, and their levels of physical activity. And then we asked them to come back a week later to do an assessment of their fitness and to fill in a second questionnaire regarding their health-related quality of life. So we had 191 people take part in the study in the baseline assessment. 87 people were in the usual care control group, and 104 people received MedX Impact. So just under three quarters of our participants were female, and the average age was 56 years, and just under 2/3 had had a breast cancer diagnosis, 16% had had colorectal cancer, 13% had had prostate cancer, and the other 11% had had other cancer diagnoses. On average, participants attended 66% of the supervised exercise classes, and at the 6-month period, 51% of the participants were deemed to have completed the trial. So what did we find? So when we went on to analyse the results, when we looked at cardiorespiratory fitness, we saw that for both groups, from baseline to the end of the 12-week programme, their fitness improved. That improvement in their fitness was maintained by both groups when they came back to see us 3 months after they'd finished the programme. We also saw a similar relationship for satisfaction with life and mental well-being, where again this increased for both groups from the start of the programme to the end of the programme, and the improvement that was achieved was maintained 3 months following programme completion. Looking at participants' daily step count, so looking at levels of physical activity participation, this is where we started to see a difference. So for both groups, their daily step count increased during the course of the 12-week programme, but only the participants who received MedX Impact were able to maintain the improvements in their step count 3 months after finishing the programme. And again, we saw a similar relationship for quality of life, where again, this increased for both groups over the course of the 12-week programme, but only the participants who received MedX Impact were able to maintain that improvement 3 months after finishing the programme. So just to summarise, participation in 12 weeks of community-based exercise rehabilitation significantly increased levels of physical activity participation, fitness and mental well-being, and health-related quality of life. And those improvements were maintained in fitness and well-being for both groups at 6 months. But the participants in MedX Impact also had additional benefits, where the improvements that they saw in their daily step count and quality of life were also maintained at 6 months. And so our results overall really demonstrated preliminary evidence for the effectiveness of this programme. And participants who took part in the 6-month reassessment, we asked them to fill in a questionnaire to tell us about their experiences of MedX Impact and ways that they thought we could improve it if we were to do it again. And so that's the next steps, that we want to integrate their recommendations to increase the effectiveness of the programme and to optimise it for future delivery. So just to summarise overall, physical inactivity is a serious and prevalent issue in the context of cancer. Physical activity promotion and prescription do not currently feature as part of usual care for all individuals on the cancer journey. And this represents an important missed opportunity to maximise patients' quality of life and health-related outcomes. And the evidence from this research provides meaningful evidence that is specific to the Irish context, that can be used to advocate for increased support for oncology healthcare professionals to embed physical activity promotion within usual care for every patient. It provides evidence to advocate for the inclusion of a holistic approach to rehabilitation following cancer treatment in order to optimize patient health and well-being. The provision of physical activity services to facilitate increased access to support and expertise in order to empower individuals living with and beyond cancer to make physical activity part of everyday life. So within the National Cancer Strategy, the Department of Health has made a commitment to invest in cancer survivorship programs. And this research provides evidence that's specific to the Irish context and could inform the development of such programs. And MedX Impact demonstrates future promise beyond this research project because it has the potential to be scaled and implemented at hospital and community centres at a national level. So because this research was conducted at the knowledge into immediate societal benefits. And this quote was pinned by a member of the Move On programme to a notice board in MedX, and it highlights the impact of the cancer journey. And it is hoped that findings from this research can assist in advocating for the inclusion of physical activity within cancer care to support those living with and beyond cancer to live healthier and better quality lives. And the story doesn't end here. We're continuing to publish this research. So we've had 3 papers published on the research so far, and we're continuing to share our findings at scientific meetings. It has been presented in Prague and Orlando to date, and hopefully more presentations to come in the future, and obviously to continue to share our findings with the public as well. And I'm hoping to continue my research in exercise and cancer, and I'm hoping to secure funding this year to look at a project of the role of exercise and nutrition, specifically in the context of childhood cancer. But just before I finish, it really takes a village to do a PhD, and this project would not have been possible without so many people. First of all, to all of the participants who took part in the programme, and I hope many of you are on the call here today. And this research just would not have been possible if it wasn't for your generosity and your willingness to share your time and your experiences with me. So a very sincere and heartfelt thank you for everything. To my PhD supervisors, Niall, Brona and Catherine, thank you so much for your unwavering support at every step in the journey. And to the team in DCU and data collection, it involved a really big effort from so many people. So thank you everyone for your support, and particularly Lisa and Fiona. And finally to the Irish Cancer Society, thank you for funding this research. Thank you for supporting me at every stage in the journey, and to anyone on the call today who has donated to the Society in the past. I hope today's presentation gives you an insight into where money can go and the potential impact that it could have in terms of improving cancer care in Ireland. Thank you.
Hi, Mairéad. Sorry, I was just having a problem there restarting my my video camera. That was really excellent. Really appreciate that, and it's great to see we have a few questions. I have a few myself as well, but we have a few questions and comments. So just to start off, Ina says thanks very much. A very informative webinar. So onto the questions. So we have a question from Jar. Just wondering if Mairéad has found if exercise is more important or beneficial in one type of cancer over another. So for example, bowel cancer versus lung cancer.
Yeah, so that's maybe a broader question for the literature rather than my specific project. So there's lots of different studies that have looked at the benefits of exercise in the context of different cancer diagnoses. And what I'll say is that really that evidence is mounting. We know, particularly in the context of breast, colorectal, prostate, endometrial, bladder, kidney cancer, exercise is really beneficial, and we have evidence to support its effects. throughout the cancer journey. And then for other cancers, maybe that are less common, there needs to be more work done. You know, obviously we hope and we anticipate that exercise has a beneficial role to play there as well. But it can take a little bit of time for research to catch up with that. And so I think the evidence is building all the time, and definitely important across the cancer journey for all individuals on that experience.
Presumably as well, there would be variables like people's age, their pre-existing fitness, and the extent of the malignancy and stuff like that. So is it likely that there isn't a one size fits all type answer to that question? Yeah.
Exactly. Yeah, we have kind of broader level recommendations around how much physical activity is recommended at a broad level, but exercise prescription really needs to be on an individual basis and based on all the factors that you highlighted there, Rob, and others as well.
Sure, and also just to say, Ger, I suppose there's also different stages where exercise can intervene as well, because I think much of what we've focused on is post-treatment in this research. But obviously, pre-treatment can also be quite important for certain malignancies, and certainly there's mounting evidence, I think, Mairéad, in bowel cancer. Would that be the case?
Yeah, so prehabilitation refers to exercise from the point of diagnosis until treatment begins. And there's a huge amount of evidence. Dr. Lisa Loughney is a leading expert in that area, particularly in the Irish context, around the impact that exercise can have in preparing people for treatment and to minimise complications and optimise outcomes as a result of that. And so definitely a role to play in terms of physical activity, you know, before treatment, during treatment and after treatment, definitely.
Sure. Okay. So there's a few kind of more specific questions. So you may feel comfortable or not to answer those. So I suppose the next one, which to me, I suspect is probably the most common question. And I remember meeting you over at the MedX program in DCU, and I know it was a common question. So do you feel that there's a risk of doing too much? And do I see and there, and I think there's another question that the two twins are coming up there. Do you think that there's a risk of doing too much?
A risk of doing too much exercise?
Yeah, so I suppose Anne's question, and I can ask Anne to unmute if I'm asking it correctly. Anne, you should be able to come in there. So you'd asked there, sorry, because there's so many questions coming in now, it's actually shifting up. Yeah, so you'd asked, is there too much? Maybe we won't go through all of the details of your medical condition, but you've gone from being sedentary to, you know, to being very active. And I suppose there's a worry of what's
next? What's next? You know, getting the 20 kilos down, feeling good, getting an improvement in the development of the disease or the reduction of the disease. You know, wanting to join Joe Wick's PE for kids and thinking, is that a bit too much? You know, what's the risk of doing too much, even if I feel good? Yeah. So I suppose maybe going back to that slide that I showed you about the dose response relationship that we know with physical activity. So when we get to really high levels of physical activity participation, we can still achieve improvements, but I suppose that magnitude kind of tapers off a little bit. And so the recommendations really are around aiming to achieve a minimum of 150 minutes of moderate intensity aerobic activity each week. So that's that whole body exercise, walking, cycling, swimming, with an upper limit really around that 300 minutes a week. And, you know, I suppose you just have to be mindful of other things as well. If you're engaging in very high volumes of physical activity, you're obviously expending a lot of energy. And from a nutritional perspective, you'd want to make sure, you know, that you're maintaining weight if that's relevant for you. You know, other people might be on a weight loss journey and that might be something else to consider, but really sticking with those guidelines of at least 150 minutes a week to an upper limit maybe of around the 300, and supporting that with resistance exercise as well to maintain your muscle mass, so muscle strength. Yeah, that's the area that I had the biggest doubt about. It's wonderful losing everything, but you know, to strengthen up that body, to have the strength to get this disease under control, you know? Yeah, and for me, and the big thing really is that when you're doing great, it sounds like you're really fantastic in terms of making physical activity part of your lifestyle. The key at that stage then becomes about long-term maintenance. It isn't necessarily about continuing to increase it all the time. It's about how can you make sure that the level of activity that you're engaging in is sustainable
Yeah.
and something that you can make part of your life, going into the future.
Yeah.
Yeah, I hope that helps.
Thank you, Mairéad. Thank you.
Thanks very much, Anne. So a comment that's kind of related a little bit to what Anne and her sister were bringing in there, that there's a gap in aftercare. I think you kind of highlighted that as well.
Yeah.
So, some people are able to access information and others aren't. Would you agree with that point?
Yeah, so this for me was one of the big things that came out of the project overall, is that we were really able to capture evidence that documents that there is this gap. Our participants in our focus group study told us that when they finished their treatment, they were discharged, they were looking towards getting back to work, resuming somewhat normal life, and yet they had been through a significant trauma and had no support available to them. For some, that felt how to recover and how to go about that. And so looking to a more holistic approach to the aftercare, and that's something that the Department of Health have made a commitment in the National Cancer Strategy, that those survivorship programs will be developed and that they will be put in place to try and support people to optimize their physical, their psychological and their social health after cancer. And so I think, it's an ever evolving situation. I think we can always identify ways that we can improve care, but I think that aspect in particular is something that there's a lot of momentum behind now, and hopefully we'll see that translate into supports for people during that time.
So a related question, and Anne's sister, who's in the UK, from what I can see from her question as well, where can people who are out of that system, who don't have access, where can they get access? Who can they talk to about these questions? And maybe you have a little bit of experience from the UK from your previous. So more broadly, I mean,
like physical activity support, you mean, Rob?
Support and information, I suppose. Yeah. Confidence, around these things, and cancer knocks one's confidence. I think is a significant issue. Yeah. One's worried about one's health and stuff like that. And I think that maybe comes in with Anne's question too. So at the minute, where could someone go to get some information, presuming that they're like the majority of people and don't really have access?
Yeah. So there's lots of really great websites and resources that are out there. Macmillan have a wonderful suite of resources that are available, and they have a manual, and particularly now that we're all in an online space in the context of COVID, there's more and more things coming available online, lots of them free. Sport Ireland have really great resources of exercise classes that you engage in at home. There's just, as an after point for today, I could put together a little resource pack, maybe as different places, signposts that people could go to get more information if that's something that people are interested in.
Yeah, I know. I think they'd appreciate it, and maybe I don't know if it's possible, but I suppose some of the aspects around that might be specific to someone's malignancy. So Anne's sister has a particular form of cancer, and I suppose there will be some concerns about it or that. So yeah. I suppose for some general things that would be useful, but it should maybe somebody go back to their GP or their oncology team and see.
Yeah, so the recommendations now around how healthcare professionals can be supported to make physical activity promotion part of their practice is that, number one, they assess how physically active their patient is, and they assess their safety for exercise. So like you say, Rob, people can be at different stages of the cancer journey, lots of different things going on. So, we need to establish that first. And then for them to make that recommendation, be physically active, here's what I think you should do. But to accompany that recommendation, ideally with a referral to a program that can offer suitable follow-up support and expertise. And from my experience, and I see lots of names that I recognize on the list there. So hello, everyone. Lovely to see everybody here. And from my perspective, and I think the participants on the call here will agree that that shared experience of exercising in an environment with other people who have been through what you have been through, that's so powerful from what I would call an adherence perspective, you know, sticking with the program, that social support is really powerful. And so, you know, I know there's lots of, I saw a wonderful piece on Sport Ireland. There was a lady who, I think it was over in the West, was it in Galway maybe, she set up a dragon boat racing group for survivors of breast cancer, because she was in an area where there was nothing happening and she really needed that support, and that club is thriving. So, you know, I think there's probably more services out there, but I suppose it's, yeah, just getting a collective list of them together to signpost people to them where possible. So
yeah, no, that would be brilliant. And certainly I echo what you say. I've met some of the dragon boat groups and they are just brilliant. It isn't for everybody, but I mean, for those, it is just absolutely brilliant. And some of the other rowing groups, I met a rowing group out in Rush when I was out swimming there one day. Now, we've a large number of other questions, and I promised you that I would lecture, because you're actually lecturing in a few minutes. So I'm going to rapidly fire through these as quickly as we can. There's another thanks there. Mairéad, when will your research findings be made available to the public? I suppose it's really in the research literature, is it?
Yeah. So it's ongoing. So three of our studies have been published, fourth one underway, and then 2 more to come after that. So work in progress.
Yeah. Okay. There's a professional here, Erica Bennett, wants to get in contact with you. So how might she best do that? We can help that. So Erica, if you email research@Irish Cancer in the background, we'd be more than happy to put you in contact with Mairéad, and
Thank
do
you.
so with
hopefully
our
my Twitter
or your Twitter, exactly. Yeah, we're all on social media at the minute. And I see Patricia was tweeting there earlier as well. So somebody, again, another positive comment from Sheila, saying that she really benefited and was able to do the whole Camino de Santiago walk, 800 kilometers, fair dues. Sheila, I don't know that I could do that.
Well done, Sheila.
Yeah, due to finish, so a lady is due to finish chemo treatment in May. Is MEDEX a resource that she would be able to access, or is it still in development?
Yeah, so since this project finished, MEDEX transitioned from DCU and is set up now as XWell Medical. So that program is still ongoing. It's an absolutely fantastic program. If anyone is interested in engaging in a community-based exercise program, do contact the team there. It's led by Dr. Noel McCaffrey, and a whole team of wonderful exercise instructors. And it offers exercise to individuals with different chronic diseases. So if you know someone who has cardiovascular disease or respiratory disease or cancer, you know, there'll be supports available there. So
and people often have multiple of those together. I mean, we think of people as singularly just having cancer, but people with cancer can also have heart disease or asthma or various other things. And I'm sorry to be rushing you through just with the questions. And actually, we might just give a shout out again to that. That's XWell, EXWELL, I think so.
XWell Medical. XWell Medical. Yeah. Thanks, Rob.
So
yeah.
in terms of people kind of finding it, a question from Kevin. Well done. Using the term exercise prescription would also mean that OTs and professionals who give or supervise need to get their own specific training. So there are some training courses, I think, in these areas, aren't there? And certainly I know XWell certainly have their own training. So
yeah, there's a big movement now where a big leader in the exercise and physical activity space, Anna Campbell, who's over in Edinburgh, and Anna has set up an organisation called Can Rehab, and that organisation focuses on training exercise instructors specifically in the context of cancer. So it's wonderful that there's a training program there specifically, and you know, given the complexity of prescription that can be in certain situations. And so, you know, that training is really comprehensive and there to support people. But I think there is more that we can do to support other healthcare professionals in oncology and to embed physical activity promotion practices in their usual care as well.
So Maura O'Hagan essentially says hi and good luck with the research. You must know.
Hi, Maura. Thanks for your kind words.
It's all obviously your fan club that have subscribed to this, and fair dues to the fan club. So more positive notes, and we do appreciate that. I'm sure Mairéad does as well. Amy Walsh mentions PINC certified physio or oncology specialist. They have a database in Ireland. Is that something that you might include maybe in your list then?
Yeah, fantastic. Brilliant. Yeah, I wonder, Rob, if we could even maybe retain the chat from today, if there's suggestions in there.
Let me see. Yeah, I think we have the technology. So I'm just trying to do that now. This is live, folks. No, hang on. Yeah, so before we can actually, maybe Shauna, who can hear me in the background, might be able to do that for me. Not open. There is some way to save chat. That's it. Now, so chat saved on my thing, so I'll certainly keep that. Lots of positive comments there. Yeah, so I think we need to wrap up there anyway and let you back to your students and start spreading the word and the education and that. So I'll say a few words and just to say really big thank you to everybody, and thanks so much for all the questions and the engagement. Do keep in touch with us around these things. You'll see the Cancer Society doing some activities in these spaces as well over the coming months. But what a fabulous talk by Mairéad, and just thanks, Mairéad, and hope to talk to you again soon.
Thanks a million. No, thanks so much to everyone for coming along today, and thanks so much, Rob, to you and all the team for putting it on and giving us the platform to share the results of the research. Really appreciate it. Thank you.
Okay. Bye now. Bye. See you, everybody.
Thank you. Bye.